Hello, this is Dr. Prathiba, practicing gastroenterologist at Bangalore. Today, I would like to discuss about one symptom is bleeding per rectum or bleeding through the anus. This is one of the most common symptoms which occurs in many of our patients. So, I would like to discuss with you the most common causes of this symptoms. The most common causes are either external piles, internal piles, or fissure. Piles or hemorrhoids and fissures. So, the cause for all these three are usually constipation. So, when a patient has constipation or when they have hard stools, they try to press too hard and give a lot of pressure, which will in turn cause either a tear in the anal lining, which is called the fissure, and this tear can lead to severe pain and bleeding. So, how do we go about treating this anal fissure? This anal fissure is usually treated by giving local application medications and also preventing constipation by giving laxatives. So, the other cause for bleeding PR is hemorrhoids. Hemorrhoids can be internal or external. So, in this external or internal hemorrhoids, again, the pain is a predominant feature in external hemorrhoids. Internal hemorrhoids is painless bleeding. So, this bleeding can happen even after passing motions or before passing motions, and they have drops of blood falling into the commode. So, this symptoms is an early symptom of piles, and in piles we have 4 grades. So, grade 1 being least and grade 4 being very severe piles which will need surgical management. So, differentiating and diagnosing the stage or grade of the piles is very important for a complete cure of this symptoms. So, how do we go about diagnosing? We have tests called proctoscopy or sigmoidoscopy, and this can we put in a camera fitted tube which goes inside your large intestine up to the last 10 centimeters of the large intestine, where we see the most common causes of bleeding through this area. So, once the diagnosis of hemorrhoids are made, the stage of the hemorrhoids are made, we start the treatment. The first 2 stages are usually treated by giving medications and local applicant gels and also preventing constipation. And the later stages are usually treated by surgical methods. So, other uncommon but a very dangerous cause for bleeding per rectum is cancers of the rectum or the colon. So, this is very important, but this usually occurs in the elderly age group, but we can never say that it doesn't happen in the younger age group, though it is rare. So, to diagnose a cancer of the rectum or the large intestine, test which is useful is sigmoidoscopy or colonoscopy. So, once we do this test, we can diagnose the site of the cancer, and then we can take biopsies and also get to know what is the type of the cancer. So, colonoscopy aids in diagnosing all types of bleeding PR. So, this is one of the important tests which is used to diagnose the bleeding PR. And treatment of cancer depends upon the stage in which it is diagnosed. So, this is about bleeding PR. Thank you.